Good morning. Today we will discuss about the respiratory quotient. In the previous session we have discussed about the cellular respiration. So now in this session we'll discuss about the what is respiratory quotient. Respiration, as discussed in the previous session, respiration is a process by which the respiratory substrate is broken down to metabolites to release the energy. So there are two types of operating systems for the respiration, that is, one is aerobic respiration and the anaerobic respiration. The aerobic respiration is a metabolic process that occurs in presence of oxygen, whereas the anaerobic respiration occurs in absence of oxygen. So this respiration occurs through various metabolic pathways. That is, first and foremost step is glycolysis, which is followed by the Krebs cycle or TCS cycle, and that is followed by the electron transport chain in oxidative phosphorylation. So now let's discuss what is respiratory coefficient. Okay, there is a lot generation of energy in the respiration, but what do you mean by respiratory coefficient actually? So the respiratory coefficient is defined as the volume of carbon dioxide released or the volume of oxygen absorbed. Actually, in a brief words, respiration is nothing but taking of oxygen and breathe out of carbon dioxide. So the respiratory coefficient is discussed or defined as the volume of carbon dioxide that is released to the volume of oxygen absorbed. This respiratory coefficient is a dimensionless number because it is a ratio of volume. Hence, there is no dimension for this or to measure to this respiratory coefficient. It means it is a scalar. This respiratory coefficient is used to calculate the basal metabolic rate. Also, this respiratory coefficient is measured by an instrument called respirometer. So what are the characteristics of this RQ, that is respiratory coefficient? So we know that the lesser the oxygen consumed or the higher the carbon dioxide produced, the higher level of our respiratory coefficient in the molecule. That is, if there is any molecule that is undergoing a respiration or any metabolic process, so how can we calculate or how can we estimate the respiratory coefficient is, if there is a higher amount of CO2 produced or the lesser the oxygen consumed, then there will be a higher level of respiratory coefficient. Moreover, this respiratory coefficient of any organism or any substance falls between 0.7 to 1. So what it indicates, if the respiratory coefficient is nearer to the 0.7, it indicates that the carbohydrate oxidation has occurred. It means the oxidation process is being carried out, whereas if the RQ, that is the respiratory coefficient, is nearer to 1, it determines the occurrence of fat oxidation or lipid oxidations. So that is, if exactly respiratory coefficient is 0.7, then we can say that it is a pure carbohydrate oxidation, and if it is purely 1, exactly 1, we can say it is a pure fatty acid oxidation. Moreover, the carbohydrate oxidation's respiratory coefficient generally remains low as more oxygen is consumed. See, in the glycolysis pathway, there is a consumption of more amount of oxygen. Hence, this glycolysis pathway, the RQ, the respiratory coefficient of the glycolysis pathway, glucose will be very less. That is, it might be equal to 0.7. But whereas during the oxidation of the fatty acids, there will be a release of oxygen. Hence, the respiratory coefficient will be equals to or nearer to 0. Similarly, the examples are the presence of insulin in substances results in higher level of RQ, as insulin increases the lipid storage of substances during respiration. So what are the, we can say that what are the applications of respiratory coefficient, or where we can apply this respiratory coefficient? The respiratory coefficient can be used in the determination of the basal metabolic rate, that is to increase or it can be used to find the nature of the chronic diseases like liver cirrhosis, or we can assume the we can use it is used to calculate the growth in weight of diabetic patients who are dependent on or dependent upon especially the insulin. So the or the fatty acid lipid profiling also, in the lipid profiling also we can apply this respiratory coefficient. So these are some, so this is about respiratory coefficient. Thank you.